Hi, welcome to Capital Smiledocs Dental YouTube channel. I'm Dr. William Vu, and this video's topic is on adult orthodontics. Did you know that according to the Ontario Dental Association, 30% of patients who are undergoing orthodontic care are adults? Adults these days are undergoing more and more orthodontics because they realize that they too can have the smile that they have always wanted. There are many benefits to having orthodontics or braces as an adult. One, it helps to improve your appearance. Two, it increases your self-esteem when you're doing face-to-face interactions with other people, but there's also a health benefit. When the teeth are crowded and there's not enough room for them, what happens is that teeth will overlap each other and create these nooks and crannies that are hard to keep clean, and it creates a food trap and a bacteria trap. So people who have crowded teeth, studies do show that they are at a high risk of getting gum disease and periodontal disease, which is a bone disease. With orthodontic treatments for adults these days, there are a lot of options. They range from the traditional braces to the ceramic braces, which are clear and non-metal, and there are the Invisaligns as well. Now, each one of these options have their own specific indication to them, and the best thing is to see a dentist to have an assessment. With orthodontics, what we would do is the first appointment we would do an assessment. We would take records of your dentition. We would take impressions so that we can study how your bite is in relation to the upper and lower teeth, as well as we're going to take additional x-rays so that we can have a look at the root angulation of your teeth in relation to each other, as well as your skeletal or your bone-jaw relationship with the upper jaw compared to the lower jaw. Now, with orthodontics, we are not just straightening teeth, but we're also improving the bite. When a bite is off, the teeth do not fit together well, and what happens is that when you bite down on these crooked teeth, it creates interferences. With interferences, it will cause what's called a functional shift, where your jaw will shift to one side to try to make your crooked teeth fit better. And the shifting, or the functional shift, what we call it, will cause strain to your jaw muscles and then lead to TMJ problems and other health concerns. So we're looking at achieving a better bite and also making the upper jaw and the lower jaw fit together better. So sometimes you could have skeletal problems where the upper jaw is not in proportional size to lower jaw. So we take all this into consideration, and then we would come up with a treatment plan. We would sit down with you, go over the details as to how long the appointment would be, what's involved, and answer any questions that you have. So if you have any questions, check us out on capitalsmiledocs.com to find out more about orthodontics for adults, as well as you can call us to ask for a consultation.